Okay, okay, guys. So today it's going to be pretty much patient counseling and patient care. So you may not find a lot of DTPs, drug therapy problems. However, it's very important for you to look to the patient or to look the whole case, and you have to tackle every single point. That's what called patient care. Um, I believe we had this discussion before in the first, and we showed the difference between only counseling and the patient care. It's a more of generalized process. So you are treating here not only the situation, you are treating or you are dealing with the situation of the patient as a whole. Okay. So you're going to deal with the patient concern, which is the main issue of the situation, but along with it, you have to have yourself to make yourself like aware of the other aspects of or the other points or the factors of the patient profile that may affect your outcome. Okay. So we're gonna start with station number 1. Who will be the volunteer who's gonna participate with us?
Okay, I can do it, doctor.
More?
Yes.
Okay, Mohamed, if you don't mind, can you please check the timing?
Yeah, sure, no problem. I'm gonna send you now the reference for the station 1 to the Telegram group, okay? I assume that you are all in the Telegram group, OSCE Pharma Free OSCE group on Telegram, correct?
Yes.
I think I'm not in this group. Okay.
You are not in the Telegram group?
Yes, I see that. Yes, I saw. Thank you.
You can see it? Okay, I have just sent it now. Okay. There we go. So guys, we have different situations here. The most important in this competency to master it is to be very keen about the patient care. Okay, you have to look at all aspects of your service care that you're providing to the patient. His medical condition is very important to know everything about it. You can focus as well on the non-pharmacological approaches. It's very important here. And if something is not mentioned in the case, but you assume that there's like a technique that you can provide to the patient and that may ameliorate his general condition, please mention it. For example, something like vaccines, something like lifestyle change, eating habits change, anything. Okay, you can perceive a value of it. Please propose it to the patient. Okay. So Gazouly, you can start right away. This is station number 1. I think Ammar would be the first candidate. Here we go.
Okay.
I'm gonna, yeah. Usually you have 30 seconds, Ammar, to check, just to go through quickly to on the reference that we have just sent to the Telegram group. Afterwards, we're gonna start right away.
Okay. Okay, I'm ready.
Hi, may I speak to the pharmacist, please?
Sure, this is Ammar. I'm pharmacist in duty. How can I help you today?
I need some recommendation over the counter medication regarding I have a little bit of stomach upset symptoms.
Sure, I'll help you on that. Can I get your name, please, and confirm age?
My name is Jennifer Abraham. I believe I have a file for me with you guys, and I'm 36 years old.
Okay, Jennifer, give me a moment to check your profile, please. I can see in your profiles that you are taking Alice. What do you use it for? Is it a contraceptive pill?
Yeah, yeah.
Okay, and I can see you are taking citalopram. What do you use it for?
For mood.
Okay, how long have you been diagnosed for low mood?
For some time, actually, and it's working.
Okay, great. Have you had any side effects from these medications?
No.
Okay, and how long have you been taking the Alice?
Alice, I have been taking it for like maybe almost like three months now.
Okay, great. No any side effect from Alice, so no any spotting, any something like this?
It was in the beginning, but for now, nothing.
Okay, great. So, and can you tell me more about your symptoms? You said you have a lot of gases, I believe.
It's like kind of benching, flatulence, and some diarrhea. Now I have like around 2 loose bowel movements per day.
2 loose bowel movement per day. Okay, so, and you said 2 days ago?
No, it happens actually like for the last 4 days. This started.
Last 4 days. Any blood? Did you notice any blood in your stool?
No blood, no.
Any fever?
No fever, no.
Any severe abdominal pain?
No abdominal pain.
Okay. So no abdominal pain, no fever. Yes. Did you notice any unexplained weight loss recently?
No.
Okay. And did you try anything for that before?
Sorry?
Did you try anything for this bowel movement and flatulence before?
No, I didn't.
Okay. Any recent change in your lifestyle, on your diet?
There is no significant recent change actually, but maybe I believe I ate like last weekend. I ate outside in a restaurant or something. Maybe that's the reason.
Okay, so did you notice any smell or mucus in your stool?
No.
Okay, only
No
loose
change.
bowel movement and flatulence.
No change. No.
Any acid reflux or heartburn?
No, nothing.
Okay. So, and being taking this Alice, I can guess you are not pregnant, right?
No, I'm not.
Are you breastfeeding by any chance?
No breastfeeding.
Okay. So do you have any other medical condition?
Other than taking the Alice and the
I mean
citalopram?
medical condition, yes, other than low mood. Do you have any I should be aware of? Any medical condition?
No.
Any prescription medications? Rather than in the profile, Alice and Cipralex?
No.
Okay. Any herbal, any vitamins, any over-the-counter medication?
I don't think I'm taking Cipralex. I'm taking citalopram.
Citalopram, sorry. Okay, citalopram. Okay, this is sorry about that. This is citalopram. Okay. Any herbal or vitamins?
No. I'm not taking anything over the counter.
Okay, Jennifer. So let me check my reference and get back to you. Before I do that, do you have any other concern?
No.
Okay, thank you. How's your diet like, Jennifer?
It's like a regular diet, pretty much. Like no change actually. However, like I believe maybe the reason of my diarrhea or flatulence is like because I went out, I ate out like last weekend.
Okay, so but you noticed the symptoms 2 days ago, right?
No, in the last 4 days, I said.
Last 4, sorry about 4
2
days.
minutes remaining.
Okay.
2 minutes remaining.
Okay.
Can
There's no
you
nausea and vomiting.
Can you give me something over the counter for
Sure,
this?
sure. And any nausea or vomiting, Jennifer?
You asked me about this before, and I said no.
I asked about nausea vomiting. Okay.
Yes. So nothing.
Okay. So
Can you give me something over the counter, please?
sure, I'll give you something. So we have here a product. Its name. Do you have any allergies?
Yes, I have allergy toward the ibuprofen, and it gives me difficulty in breathing and swollen fruits.
Okay. So I have here Imodium. So it would control your loss of bowel movement. Imodium. You can take 1 capsule of Imodium, 2 capsules right now, and 1 capsule with each bowel movement.
Okay.
To controlling your bowel movement. And at the same time, I would like to share with you some non-drug measures. So make sure you are taking plenty of water, and to rehydrate if you feel any symptoms of rehydration, if you feel thirsty or sunken eye or darken of urine, make sure you are taking Rehydran or any product to replenish the water loss.
Okay.
Okay. So,
okay,
that's it.
That's
Yes.
it. Okay. That's gonna help with my.
Time is up. Time is up, guys. Time is up.
Okay. Okay, Ammar. Is anyone would like to participate, Shabab? The same station, and then we can discuss it later. Sarah,
Okay,
I can try it.
Karen, or Sarah?
I
Okay.
don't mind. I don't.
Whoever, it doesn't matter. I am Karen, and there's Sarah as well. So
Okay,
whoever.
Karen, yeah,
Sarah-
Sarah, go ahead.
Sarah
and
can
then-
try. Sarah
we
can
do-
try. Sarah can try this one. I would like to have a new one.
Okay, my dear, thank you so much. Okay, Sarah, let's go ahead.
Thank you, Karen.
Okay. Let's start.
Okay.
Okay, Mohamed, take care of the timing, please. Okay, may I speak to the pharmacist, please?
Yeah, sure. I'm Sarah, the pharmacist on duty. How may I help you?
I need something over the counter to, if you can recommend it. So regarding my stomach upset symptoms.
Yeah, sure. I'll try to help you. And may I know your name, please?
My first name is Jennifer. Last name is Abraham. And I believe I have a profile with you guys here in the pharmacy.
Oh, yeah, Jennifer. I can see here your file. And you are 36 years old, am I right?
Yes, you're right.
Okay. And I see here that you are using Alice, Alice for birth control. Is that correct?
Yes, correct.
Do you experience any side effects from this medication?
No. Just,
Okay. And I see here that you are using citalopram.
yes.
Yeah. Do you use it as prescribed?
Yes, once daily. Yeah.
Do you have any side effect or anything?
No. It's working.
Okay. Okay, good. Do you have any other medical condition?
No, I don't have any.
Do you have any allergy?
Yes, I do have ibuprofen allergy.
Okay, I'll update that on your profile. Do you use any medication apart from the one that on profile?
No.
Okay. Do you use over-the-counter medication?
No.
Okay. Is your vaccination up to date?
It is up to date, yes.
Okay, good. I want to ask you some question about your lifestyle. Do you drink alcohol?
No, I don't drink alcohol, no.
Okay. Any carbonated beverage?
No.
Okay. Do you smoke?
I smoke it.
How many cigarettes per day?
15 cigarettes per day.
Okay. Okay, we can help you if you want to stop smoking. We have a program. We can talk about this later on. But now let me just address your main concern. Do you exercise?
I walk every day, yes.
That's good. Keep it up. How you describe your diet?
It's a regular diet, actually. Like a normal diet. I try to balance my diet. However, the last weekend, it was like 4 days ago, we hanged out with my friends together, so we ate outside.
Okay, you eat outside. Okay, and okay, you said that you have a diarrhea.
I didn't say, however, I have a diarrhea. I have a diarrhea and some flatulence. Yes, I said I have a stomach upset problems. Yes. If you wanna know more about it, yes, it is diarrhea. I have like 2 loose bowel movements per day for now.
Okay, and what's your normal bowel movement?
1.
Okay. Because you're having diarrhea, do you notice less frequency of urine or thirst?
Less frequency of what? I cannot
Urination.
understand.
Urination.
What's going on with the urination? What's the
I
question?
just want to know that you're having a diarrhea if you're having any dehydration symptoms.
No, I don't. Since I started diarrhea, I try to drink more liquid. Yes.
Okay, that's good. Okay, because you're 36, are you pregnant or breastfeeding by any chance?
I'm taking LS, my dear.
Okay, yeah, I see. So it's safe to say you are not pregnant. Okay. And for how long you have been using the citalopram?
For like a year now. Yes.
1 year.
A year.
Okay, and I'll just see my my reference and I will get back to you. Is that okay?
Yeah. Okay.
Okay, I will recommend Imodium for
2
your
minutes,
diarrhea. You can take 2 capsules right now and then 1 capsule with each bowel movement. That would help you to stop your this will help you to stop the diarrhea.
Okay.
The diarrhea is bothering you more than the gases?
Both, actually.
Both of them?
Yeah.
Okay. And for the gases, you can eat a small amount of food and try to chew it slowly and not swallowing, like chew while your mouth is closed, so you are not swallowing air while you are eating. That might help you with your gas. And for the diarrhea, as you said, you are drinking lots of fluid, which is good. Try to keep it up. If the diarrhea, if you notice any dehydration, like as I told you, if the urination is less than normal, or if you pull your skin is not going back again, so seek a medical attention, go to your doctor. And I will give you a call in 2 days to follow up with you. Is that okay?
In 2 days? Okay.
Okay. Do you have any other concern?
No, I don't.
Okay. So,
okay. Thank you so much.
Thank you.
Okay, guys. Let's discuss this. Let's discuss this.
Hi, I have a question.
You have a question? Okay. Go
Okay,
ahead.
the diarrhea from last 4 days, yes?
Yes.
Okay, if diarrhea persists more than 2 days, 48 hours, we should refer the patient.
We should refer the patient. What type of diarrhea that you should? Anyone if like you just refer it like this?
No, because they don't have any red flag. But if the diarrhea more than 48 and 48 hours, we should refer regarding the guideline.
Did you work in the pharmacy before, my dear?
No.
Okay, so
I go with the minor element, not.
I understand. Okay, so I agree with you to some extent. If someone has diarrhea, how many bowel movements? You have to do your assessment. How many bowel movements does this patient has? 6, 7, 2?
6, more than 6. But if symptoms of diarrhea persist more than 48 hours.
Listen to me. So I agree with you. But is it not? Let's say, for example, this patient used to have her regular bowel movement is 1. Okay. Now she has 2, and 2 of them are loose. And they did the assessment. Is there any red flag? Okay, there is no red flag. Even there is no any symptoms of dehydration. Okay, I know it's more than 24 hours, 48 hours, but you cannot send her to as a referral in this situation. You have to give her the remedy first, and then after that, tell her if it's worsened or it's not getting better. At this point, only you can refer her. So my second question: to whom you're gonna refer this patient? Because the second, I believe Sarah told us. Told this lady to go to see her doctor. Do you think it's like a proper referral or what? If the diarrhea is getting worse, okay, or even there is if it's getting worse,
I say.
exactly. If the diarrhea getting worse, then it will be a risk of dehydration, right? Do you think that the best referral is to go to get an appointment with her like family doctor? Because you said you have to go to your doctor, I believe, right? Or it's an emergency? What do you guys think?
Emergency, I think.
Emergency, I think too.
Dehydration, yeah, emergency.
Yes. So the referral here, Sarah, you said the referral in not a proper way. That's number 1. Okay. So you have to assess first. It's not things are not obsolete here. 48 hours. Okay, go to the.
Yes, I understand. Yes, I understand. Okay.
Yes. How old is the patient? Is he like an infant at this point? Yes, you can go. Is it like a severe diarrhea, 6-7 times a day? Yes. Even if I got a patient got 6-7 times a day, and it started from one day, I will definitely refer him to the emergency directly.
We shouldn't wait. Yes, exactly.
I'm not going to wait for 48 hours here, right? So you have to do your assessment and then referral, because referral is a double weapon thing. And to whom you're going to refer. So if you're going to refer something, it has to be a life-threatening situation. You cannot refer like this. Is this situation a life-threatening in our case here? No, I don't think so, right?
Yes,
that's the main point. So you guys recommended, even Ammar recommended loperamide. And when you say Imodium, you have to say the active ingredient. Okay, Imodium, it contains loperamide. You have to take it like 2 tablets. And both of you said so, 2 tablets at once, and then 1 tablet after each bowel movement. However, both of you missed the maximum number of tablets that you're gonna take per day. How many tablets? The maximum number of loperamide.
On the box is 8, but in the minor element it's 16.
Okay, no one mentioned the maximum number of tablets, right?
Yes.
Even Sarah or Ammar didn't mention the maximum number of tablets per day, right? That's a main issue too. There is a very, very critical and obvious problem in this case too. No one mentioned it, and what we call patient care. I told you before we start, we have to look to the situation from above. Yes, the main concern here is the flatulence. You can give simethicone or probiotic, right? Because of Gas-X, for example, because she has flatulence, and you can give loperamide because she has diarrhea. But this patient is 36 years old and she's a smoker, okay? And she's taking Elise. What's the problem here? Isn't that contraindicated?
We should ask how many number of cigarettes did you
Ammar
smoke?
didn't mention this. However, I saw Sarah gonna mention, because she asked about the cessation, and she mentioned the smoking cessation. She's taking 15 cigarettes per day, and she's 36. So
okay, we should fax to her doctor to stop Alice and use another way of protection from the pregnancy.
Okay, but you're choosing the most hardest way. Stop Alice because she's a smoker. We have to recommend the patient. Okay, you have to tell the patient first. Listen, you what you're doing is like contraindicated, so you're at risk of DVT or something, right? So and she mentioned, actually Sarah mentioned about the smoking cessation, but you have to highlight why you're doing smoking cessation. Why? Right, smoking cessation is a very big issue. You cannot tell someone, okay, I can, and if you really mean it, okay, you have to stop, because it's a kind of addiction. You should, if you're looking in the future to stop this kind of addiction, please come to us. He will never come to you unless you highlight the problem, right? So that's what called you have to be passionate about you, or you have to show empathy about your patient or about the situation of the patient. What she's doing is contraindicated, right? Alice, as a hormonal therapy, plus the 36 years old situation, plus the smoking, this will put her at risk of DVT, right or wrong? So that's a stroke. That's a stroke. You're putting yourself in a risk of a stroke. So I'd recommend you to start smoking cessation, or I will call your doctor to choose another method of contraception. So that's how you're gonna put it, okay? To make sure to highlight the problem. That's what's called empathy, and that's what's called. If you tell me this, I will definitely, as a patient, I will definitely consider it. That's what's called positive patient outcome. You will get marked on how you put the sentence. But what happened is Ammar didn't even mention it. He didn't notice it. And Sarah, she said, okay, in a very lay way, actually. Oh, you're a smoker? Okay, you know what? You can come to us anytime in the future, and we can discuss smoking cessation. I will never come up to you, right? Because you didn't highlight why you do this. Right, so you have, Sarah, when you pick it up, that's a good option, that's a good point, but you have to highlight it. You have to make to show empathy that, okay, we need to do this because there is that's a big issue, or there is a contraindication here you're doing, right?
Yeah, I thought that I will waste my time.
No, it's not a waste of your time. It's a patient care. You are tackling on every single point on the patient. We are dealing with a patient, guys. If someone has a problem and it doesn't bother him, I will not take care about it. I will not care about it, seriously. But if someone doing an issue that put his health in harm and he does not know what's going on, I have to highlight it. That's what's called the positive patient outcome. And if someone like went through this OSCE exam before and he didn't pass, they will see patient care. That's a big issue. Outcome, that's a big issue. This is what's called the positive outcome. Okay. So I didn't think this station was hard at all, but it was sneaky, because like one of the main points to have this station fully solved is you have to highlight the smoking cessation. Plus, you have to highlight that, okay, we're going to give you Imodium because of the diarrhea, and you have to make sure that, okay, if this worsen or even like it's not improving, you have to go to the emergency. The referral is very important, just in case, okay? And you have to tackle the Gazix or the Simethicone. It's easy and simple, by the way, okay? Any question? Okay.
In one station, we can give 2 medication to the patient.
You can give as much as you can, as long as it's valid.
But we should say how to use it and the side effect and a lot of things. It doesn't.
There's no lot of things actually. What are the side effects of Gas-X? Nothing. It's a safe medication. You can like actually chew or swallow like 2 tablets. That's gonna take care of the Gas-X for the flatulence. That's number 1. Is there any side effect for Simethicone? Nothing. Right? What's the side effect? The worst case scenario for loperamide? Constipation. If she exceeds more than the maximum dose, the maximum safe dose, that's something different. That's why I'm telling you, if you're going to give something, you have to tell it how to take it. Loperamide, take 2 tablets at once, and then 1 tablet after each bowel movement, maximum by 8 tablets a day. That's it, simple. Okay, as long as he has no fever or stuff like that. So it's not even a second. It didn't take it, nothing. Plus, what Sarah did is like very good point regarding the non-form. She said, okay, so regarding the flatulence or stuff like that, you can eat small quantities, more frequent but less quantities. Regarding food, okay, you can eat drink more water, eat more vegetables like carrots and stuff to help with. No need for the carrots. Okay? She already has diarrhea. But anyways, like she said, like 1 point of non-form. And that's it. It's simple. But our main point here is the patient care issue. It's like you have to make sure that the other aspects of the situation is good, is doing good. Okay. Okay, sure. Okay, Ammar, everything is clear. Sarah, everything is clear.
Yeah. Thank you very much.
Okay, sure.
Doctor, when I have to focus on the patient concern, and when I have to focus on patient concern and all aspects of patient care. So
in every station, because you are treating the patient, and there is. Is it the first time for you, Ammar, to go through OSCE exam?
Yes.
Okay, that's good. So if you ask your colleagues, whoever failed from before, they will get the letter. They said fully solved, unsolved, and they said patient outcome. Positive outcome, not fully solved, negative outcome, stuff. What does it mean by negative outcome? That the patient is convinced that what you're telling him is on his favor. For example, Sarah said, please, since you're smoking, come to us in the future and we will discuss it like smoking cessation. And what do you think is going to be your reaction if someone told you this? You were going to nod your head, yes, for sure. Inshallah, right? That's a negative outcome. However, if I told you, listen, you're a smoker, okay? You're 36 and you're on hormonal therapy. Those combination would put you at risk of stroke. Okay, so let's work on this, because that's a very important issue beside your main concern as well. How about starting smoking cessation as soon as possible? Or if you don't, we're gonna contact your doctor to have another contraception method. In one sentence, not even a second. Okay, how this gonna have an impact on you as a patient? Oh my God, right? We are in deep situation, right? And this pharmacist is taking care of me, and he's aware of what he's saying, right? I showed empathy here, and I highlighted the problem, and you will take an action. That's a positive outcome. Got the difference? You have to deal with counseling. Yes, there is a big difference. It's the same sentence, but in a different way. So you have to have, as a patient, it has to have a positive impact on you, right? So that's what's called positive patient care or positive patient outcome. And then the marker guide is going to have a take on it. Okay, you highlighted this situation and you dealt with it properly. That's it. Okay, you have to deal with the patient. We are treating the patient. We are not treating the main concern only. We're not treating the disease. We are treating the patient. Okay.
Okay, I got it. I mean, there's no any notes on the doors to get my attention about there is a drug therapy problem, there is drug interactions, there is nothing to.
Usually in the counseling, there is no drug therapy problem, but you can give advice and give education. Okay. Usually in real life, there is some patient taking medication that are contraindicated with each other, right? For example, a patient is used to take thyroid with food, and his thyroid levels are maintained this way. By the book, if you're going by the book, thyroid medication has to be taken on an empty stomach, right? But he's taking this since so long, and he's adjusted, and his doctor knows, and this patient knows. Okay.
Okay.
So that doesn't mean there is you give the advice, but doesn't mean it's contraindicated or what he's doing is wrong. usually in real life, you can find a patient is taking methadone, for example, plus quetiapine. If you check on the lexicon, methadone and quetiapine, like QT prolongation, this guy is gonna be, it's a red flag, you know, it's gonna be this. But I can see it in real life, like for like so many prescriptions. What does it mean? You have to do your job as educating, but it happens. But you have to advise. Okay, that's what called. Okay, listen, this medication may put yourself in like, or your heart in bad situation. He will tell you back. Okay, my doctor is doing ECG, for example, before giving me this medication. So it's a you know, but you have to have an impact on this. You cannot.
Okay, just touch this point and go on for a patient concern, right?
Exactly.
Okay.
Yes.
Okay,
You
I
can
got
find
it. Okay.
a guy coming to you with a counseling for Viagra, for example, and he's taking trazodone, okay, or taking nitroglycerine, whatever. You can find it in his file. But when you counsel, doesn't mean the DTP. You have to tell him. Okay, you have to tell him you cannot take them together. However, they're contraindicated. They can put him to death, right?
Okay.
But
right.
you have to
Yes,
advise them. Don't take that. That's what means by counseling or patient outcome. Okay.
Okay, I got it. Thank you.
Okay, sure. Mohamed, the next, please. Mohamed. Thank you so much.
Yes, station number 2.
Okay, second.
Okay, reference. I'm gonna share the reference now to the. Here, I think there's no reference here, guys. Yeah, no reference provided for this station. Okay.
I will take the one with no reference.
Karen, yes.
Yeah.
Yeah. Okay. So let's start.
Yeah.
Okay.
Michael, 30 seconds. You have 30 seconds. Okay, should I start?
Yeah, go ahead, start.
Hello, may I speak to the pharmacist, please?
Hi, I'm Rag, the pharmacist in duty. How may I help you?
Hello, how are you? My name is Caroline Churchov, and I would like you to recommend me some over-the-counter medication regarding my stomach upset.
Yeah, of course. Caroline, please have a seat in our private counseling area. Whatever we will discuss will be confidential. May I confirm your first and last name and your age?
I am 65 years old. My first name is Caroline. Churcher is the last name.
Okay, Caroline. Could you tell me more about your symptoms? What happened?
I feel like a stomach upset, burning sensation, sometimes nausea, and I think I need gravel for that.
Nausea and burning sensation. Okay, did you notice the symptoms when you feel the symptoms, it's related with a time per day or a medication you are taking, or any relation between the symptoms and any like a behavior or any habit during the day?
I don't notice actually, but usually either in the morning or in the lunchtime. Usually, you know what? This is not the first time it happened to me. I have a sensible stomach since 5 years ago.
You have what?
Like my stomach is like a little bit sensitive.
Sensitive.
Yeah, I feel it's sensitive stomach like since 5 years ago, and this is not the first time that happens to me.
Okay, and did you see your doctor for that or try anything?
I didn't try anything. No, that's why I'm here.
Okay, and the recent symptoms start when? You told me already. I forget. It's
what? Sorry, what's your question?
The current symptoms.
It's a recurrent symptoms. Yes.
It's when did it start?
Usually, like during the day, like either in the morning or in the lunchtime.
Okay. And did you experience any fever or any vomiting?
No, no vomiting, but I usually have like nausea, sometimes burning sensation and stomach upset.
Okay. I can see your profile here, your medication. You are taking glucosate sodium at night. Are you still using this medication?
Yes, I use whatever in the blister pack. I use it like as it is, yes.
Okay, okay. And can I know why you're using naproxen?
My joints hurt. So the doctor prescribed me naproxen, and I usually take it when I need it.
Okay. And do you know how you take it, like after food, before food?
I don't know. Usually I take it like before I eat, or I believe like it's 2 times a day. So
you're taking it on empty stomach?
I don't think so. I eat. I remember I eat.
Okay. How about venlafaxine?
After food too, I think.
Okay.
Yeah, in the breakfast time, right? This is the 2 capsules. Yes, it's after the breakfast time.
After breakfast. Okay. And clonidine, you're taking it 1 tablet twice a day?
Yes.
May I know how you take it?
1 tablet twice a day.
Okay. Do you have any other medical condition away from this medication?
I take quetiapine, and that's for mood, I believe.
Mm-hmm.
Yeah. Yeah, that's pretty much it.
Okay, you're taking 2 strengths of quetiapine. It's 25 and 100 milligram, and you take the total like 125 at bedtime. Is it correct?
Okay. Whatever in the blister pack, I take
Okay.
it.
Okay. Okay. Do you have any allergy?
No, I don't have any allergy. No, I don't think. No, not to my aware. No.
Okay. Do you take any over-the-counter medication?
No.
Okay. Any herbals, vitamins?
No.
Okay. Do you drink alcohol?
No, I'm not a drinker.
Do you smoke?
No.
Do you have time to do exercise?
I try to walk my dog every day.
Okay. Do you drink caffeinated beverage like coffee or?
No, I don't drink either tea or coffee. No.
Okay. So actually, I can see from your medication that you are taking a lot of medication which is like hard on the stomach, especially venlafaxine and naproxen. And you told me that you're taking naproxen on as needed basis, but still like the co-administration of all of those medication together might cause some stomach upset. So do you feel like okay? So yeah, I would recommend to just make like when will be the next appointment with your doctor?
Next month.
Okay. May I know why you're taking clonidine? For which indication?
Clonidine. It is the small pill, 1 in the morning, 1 at night. Yeah, that's for. I believe that's also for my heart. That's what the doctor said. I think so.
For your heart?
Yeah, I think so.
Okay, actually, I feel that you are taking too much medication in high dose. So I would recommend to make a quick medication review with the doctor and check whatever you do not need to take it. We can like lower the dose, or even like I think that clonidine. There is no like a main indication for this medication. We can check if you do not need it.
Should I stop clonidine?
Time is up, guys.
I will not stop. I will not recommend to stop any medication right away because we
Time is
might.
up, guys. Okay.
Okay.
Okay, Karen. Thank you, my dear. Thank you. Okay. Anyone else who would like to participate? Abby? Hani? Safwat? خش يا محمد انت طيب ولا اعمل ايه انا مش فاهم.
يلا انا وانت.
ادخل انا تاني.
نو كارين ثانك يو سو ماتش معلش. خش بعقلي خش داخله بروحين في اللعبه معانا.
Sorry, I want to know that. Do you have joint pain now?
When we discuss it, Maria, do you wanna join or what?
No, join means again
Okay.
repeat the case.
Yes. If you don't want to repeat the case, okay. So we will discuss it later. Okay, Jad, let's start, my friend. Okay.
Yeah, hi, I'm Noha, I'm not Jad.
I'm sorry. Okay, Noha.
Hi.
Okay, let's start.
Let's start right away, guys. Go ahead.
Okay. Hi, I'm Noha, the pharmacist. How can I help you today?
Hi, how are you? Are you the pharmacist? My name is Caroline, actually, and I have a profile with you guys here. I need something for I didn't gravel, actually. I believe like my stomach is upset. I have burning sensation and I got nausea.
Okay.
And I need
Yeah.
Yes.
Okay, I can understand how bothering this condition. I'll do my best to help you. Please be seated in our private counseling area and everything we'll discuss will be kept confidential. So
Okay.
Your name is Caroline. May I know your age, Caroline?
65 years.
65.
Mhm.
Okay, so you're concerned that you have a stomach upset and you need a medication to help you with that.
I need gravel, yes. I know gravel helps that, yes.
Okay. As I see from your medication profile, you're using a dosage or blister pack.
Mm-hmm. Yes.
Yeah. Okay, and you take naproxen 2 times per day.
Oh, I take a lot of medication 2 times per day.
Yeah, but let me start with the naproxen. Why you take this medication?
For my joint pain.
Your joint pain, and how you take it?
I take it as it is. It's recommended actually, as per my doctor, one tablet 2 times a day when needed.
When needed, and you take it when needed, or you take it regularly?
I started taking it regularly. I used to take it when needed, but I started taking it regularly because the other pharmacists put it in the blister.
Okay, I can understand. Okay, and you take it with food or without food? I mean, before the breakfast or while you're taking your breakfast?
I take my breakfast at 7:30 actually, and then I start taking my medication.
Okay, perfect. And I see here that you take another medication for constipation and for low mood. Is the constipation is good with you? Do you have any problem with constipation now?
The constipation is good with me, yes. What do you mean by the constipation is good with you? What do you mean?
I mean, do you still have constipation?
No. It's as long as I take my medication, there is no this medication. Yes.
No problem. And also you take venlafaxine for which reason you take it?
For mood medication. Yes. And
for mood, and is it improved with the medication?
Yes. It helps with some hot flashes as well. So for both. So it helps for both. Yes.
Okay, perfect. And also you take quetiapine. For which reason you take it?
For my anxiety and sleeping, and for mood. Yes, for so many purposes.
And everything is controlled. You can sleep well and
yes.
Find improvement with this?
Yes, and it's controlled. Yes, all the medical are controlled.
Okay, perfect. So let me collect my thought and I will get back to you. Just a moment, please.
No problem. Take your time.
Okay. Just another question. Do you drink caffeinated beverage?
No.
And do you drink alcohol?
No.
Okay. And do you smoke?
No.
Perfect. Keep it up. And do you have time to exercise or to move or to do any activity?
I usually walk my dog every day, as much as I can.
Okay, perfect. And would you please describe your diet?
It's a healthy, balanced diet as per my doctor.
Perfect. Keep it up. Okay. So, Caroline, as I see from your profile, that naproxen should be taken as needed. And because you take it 2 times per day, I will fax the doctor to inform him about the way you are taking this medication. Do you feel the need to take it 2 times per day?
In the past, actually, I used to take it once per day, sometimes once every other day or once every 3 days, and sometimes one tablet 2 times a day. But there is other pharmacists who put it in the blister, so I take it every day now, twice daily.
Okay, so now what I will do, I will ask the pharmacist to remove the naproxen from the blister pack.
Sorry, aren't you the pharmacist? I'm talking to the pharmacist now, or what?
Yeah, I'm the pharmacist. I mean, I will. What I will do now, I will remove the naproxen from the blister pack and keep it in a vial to take it as needed, as before. Okay. So when you feel the need to take the naproxen, you can take it. Because naproxen can sometimes be hard for the stomach. That's why you feel stomach
1 minute
upset.
remaining, okay?
So that's why I will remove it from the blister pack. Also, I can fax the doctor to ask for a prescription for medication to protect the stomach if you still experience a stomach upset. Is that okay for you?
Anything okay, no problem, my dear. So, but what about my gravel?
Okay. Okay, for now, I won't give you the gravel. I will remove the naproxen from the blister pack and keep it in a vial to take it as needed, and make sure to take it after food or within the meal. If you still have this side effect for 2 days, please call us, or I will call you back to recommend you recommend something for you, or fax the doctor for a prescription for medication to protect your stomach.
Like what?
There is many medication for this reason. I can discuss with the doctor to find the best for you.
Okay.
Okay?
Okay.
So I will call you in 2 days to check what happened.
Time is up. Time is up. Okay.
Thank you.
Okay.
What's your name, my dear? What's your name?
Me? Nuha.
نهى احنا عايزين صيدلي يا نهى. انا قلت لك انت صيدلانيه، احنا عايزين دكتور، العيان عايز دكتور. انت يو مي لافينج بصراحه.
سوري.
هكلم الصيدلي. طب انت ما انت الصيدلي.
I forget myself for a minute.
انت بس نهى يعني I feel like thank you for your participation. That's number 1. Okay, you like almost like fully solve it. However, there is some like minute fine tuning. We're going to discuss it now. Okay. But sometimes your expression, excuse me if I say it in Arabic, but ساعات العبارات بتخونك انت.
Yeah, مظبوط. عندي مشكلة شوي مع اللغة.
How about your constipation? It's very good. Thank you so much. وبيسلم عليك. فما فيش كلام. يعني is
أنا عندي مشكلة شوي مع اللغة الإنجليزية الصراحة.
No, it's not about all of us, but I'm not an English-speaking person as a first language, by the way. But you can choose like very like easy sentences and nice expression in a lay language. Does this medication doing its job? That's it. Yes, it does. Shukran. Thank you so much.
Okay.
That's it. Okay, you no need to ask about how the medical condition is doing, how is it feeling, make it easier.
Okay.
طيب Regarding this situation, you asked a very nice question about the naproxen specifically. You know, any medication, guys, any medication that used to be or has to be taken PRN basis, it should be taken out from a blister pack. That's a rule of the blister pack, right? So naproxen shouldn't be put in the blister pack because it's as a PRN usage, right? And that's what actually our candidate here, Noha, mentioned. So how she emphasized on how she's gonna take it, why it's taken, like how often do you take it? So I told you that the other pharmacist before that it used to be in a vial. Now the other pharmacist put it in a blister pack. So I feel that I'm obligated.
If your restaurant, bar, retail, if you use
في حصة تانية شغالة ماشي. So as a patient I feel that I'm obligated to take it on regular basis, one in the morning, one at night, along with the Vela vaccine. Okay, so SSRI or SNRI plus NSAIDs in general, it will, and this patient is a fragile patient, 65 years old, so it's a regular outcome because of what happened in her blister pack. Okay, how to deal with this outcome? We have so many ways. First of all, we have to remove first the naproxen out of the blister pack. We can change it to celecoxib, for example. We have to ask the doctor to add pantoprazole or lansoprazole or any PPI. Okay, taking the medication with food only, this is a non-form. It is required for protection. However, since the drug therapy problem happened, we have to have a medical intervention. So you asked me when do you take it? Is it after meal or before meal? I told you after meals. However, after meals, I told you that I take naproxen after the breakfast time or after lunchtime. So I said so because I want to stop you from telling me, okay, take it with food. So I'm already taking it with food. So I need another step. So since I'm taking it with food and it's not working, so I need a medical intervention, which is a PPI here. So I was expecting from any of you to tell me, okay, I'm going to fax your doctor to send me a PPI. 65 years old, taking all these meds, definitely she will come to a point that she needs a PPI. It's very obvious, right? From practice, yeah. Whoever told me, okay, take naproxen with food, that's not the solution because the patient is already taking it with food. Okay. So change naproxen to celecoxib, take it out of the blister pack, recommend a PPI. All those are like all together will be the main solution for this situation. Okay. Any question or anything?
Yes. Can we give Nexium for 2 weeks to the patient? We remove it then.
Definitely is not can. You should. That's what I'm saying. You should give Nexium. Yes, you can recommend Nexium behind the counter. No problem.
Yes, we have Nexium behind the counter.
Yes, no problem. If you'd like to do so, yes, you can definitely do so. Yeah.
And we have to like apologize the patient about making the mistake.
Sorry, what's your question?
We have to like also like say like we are so apologize. We so sorry about making this mistake, like keeping this naproxen in a blister pack.
Yes, it shouldn't be in the blister pack. Yes, you can do that. You can do that. I agree with that. But you have to be proactive and said, okay, that's what a mistake, and then we're going to take it out because the doctor said when needed. And when I got asked as a patient, when she asked me how often do you used to take it, I said sometimes once a day, sometimes every 2 days, or sometimes every 3 days, and sometimes 2 times a day, right? So it's not usually or not always like one tablet BID as I have been found in my blister pack. So I agree with you. You can do that.
Okay, thank you.
No problem. Okay. Why there is a question from Ammar here? Why are you using glucosamine and bisacodil? It's fine. There's no problem using glucosamine to bisacodil. You can have Usually, when the patient gets older, my friend, in geriatrics, their bowel movement is not as it should be, as healthy as it should be. But so sometimes we give a stimulant, sometimes we give like a stool softener, so to facilitate the bowel movement. Okay, so it's fine. We have a lot of
Yeah,
patients in the
it's normal
pharmacy
practice.
that they
It's
take
normal
Senecot
practice,
and
by the
Deposate
way.
for some time. Okay, so next station, Shabab.
Yeah, let's move forward, guys. Yes, we are done with 2 stations. Let's go. Yeah. Station number 3.
Station number 3.
Karen.
If nobody doesn't want to practice, I can.
Where are you from, Karen?
From Egypt.
مصرية طبعا يا باشا، اللمضة دي مصرية طبعا يا باشا.
كله ضرب ما فيش شتيمة.
طبعا يا باشا. شاغل بالك ولا ايه؟
اسكندرانية كمان.
Sorry, we don't understand Arabic.
No, we were just smoking, Karen. We were not saying anything serious. We were just smoking.
Yeah.
We were
It's not important.
But we are here.
I didn't miss a big deal.
Your name is Gol, G-O-L?
Yes, Golrang, yes.
You're Iranian?
Yes.
Yeah, I can see. Yeah, my pleasure. Okay, my dear. So station number 3?
Yes.
Okay. Okay.
We have reference here. Station number 3. I'm gonna send you now the reference to the Telegram group. It's not like it's not a sophisticated station actually. It's like a yeah.
Okay. Do you want me to start, Mohamed? Or,
yeah, go ahead. Who's gonna do the station? Karen or
Karen?
Karen, yes, okay.
Okay. Start to the 30 seconds, and then if you'd like me to start, let me know.
Yeah, go ahead.
Hello, may I speak to the pharmacist, please?
Hi, I'm Karen, pharmacist in duty. How may I help you?
Hi, my name is Suzanne, and I'm here to have your recommendation regarding my hemorrhoids. It's really painful these days, and I want you to recommend something for me or have your input for this medical condition, please.
Yeah, of course. I will help you on that. Please have a seat in our counseling area. May I confirm your name and your age?
My name is Suzanne McConnery, and I am 37 years old.
Okay, Susan. You are here seeking help regarding your hemorrhoid, correct?
Yes, yes.
Okay. Could you tell me more about your symptoms?
It's very painful actually, and itchy. However, I have been diagnosed with an anal fissure since 1 year, and I'm supposed to undergo the surgery soon. But I don't get the appointment confirmation for the surgery yet, and I need something for relief for this for the moment.
Okay, okay. Anything else you would like to share it with me?
Like what? Like no for this? No.
Okay. Do you have any bleeding right now from the anal fissure?
No, I don't have bleeding. However, it's I suffer constipation every now and then. So and that's very painful for my hemorrhoids, I believe. So
yeah, actually, constipation is one of the aggravating thing to hemorrhoids. So I always recommend you to avoid any constipation, like keep all fiber intake in your diet and drink plenty of water. And if the home care measures doesn't work, we can give you like something to keep regular bowel movement and let you poop easily. If you feel that you couldn't control your constipation, okay?
Yeah, we can definitely discuss that. No problem. Yes.
Okay.
Yeah. So, however, for the moment, I need your input regarding my hemorrhoids control. Yeah.
Yeah, of course. Do you have any other medical condition away from the one I have it in your file? I can see that you are taking blood pressure medication and Celecoxib. May I know why you are taking Celecoxib?
For the pain, yeah, in general, for the pain.
And you still taking it?
Sometimes, yes. When it's really unbearable pain, so I take it, yes.
How about your blood pressure? You take both of them, irbesartan and amlodipine?
Yeah, I take my 2 blood pressure medication, and my you know what, I it's not well controlled actually. It's not so well controlled. It's the last reading I got was 135/92, despite the 2 medications that I'm taking. So, let's focus now on my hemorrhoids, because
yeah, of course. Yeah, of course. I will happy to like give you some recommendation regarding your blood pressure, but we can discuss it later. Okay. I can see also that you are taking an Anodan suppository. Do you use it before, or you're still using it?
You know what? Frankly speaking, I tried so many things over the counter, but nothing cut the edge of the pain. I tried xylocaine as well before, but still for now, like my pain is really like bothering.
Okay, and you experience straining while you pooping. Is it correct?
I used to be, but I know that because it's been having hemorrhoids for so long now. So I became a professional in this. So I understand that I have to drink a lot of water, get like some Decosate or Senecot over the counter. Yes, I know that. Yes.
Okay. Yes. Okay. You don't have any allergy, as I can see from your profile. Is it correct?
I have some penicillin and pollen allergy.
Okay. Okay.
Yeah,
I need to update that in your file. Okay, Susan, I need to have a look in my reference. I'll get back to you. Do you have any other concern for me?
No.
Okay.
No, that's it.
You experience itching outside?
Yeah, sometimes yes, but it's my pain. My main issue is that I feel the rectal pain. Yes, the pain is like it's really bothering.
Okay, and no bleeding.
No, we cannot say there is a bleeding for the moment.
Okay, good. Okay, actually, because already you tried like two over-the-counter product of hemorrhoid, I would recommend like a new compounding cream. It's called nifedipine. It's contain like many ingredient. One of them it's like it's a main ingredient called nifedipine. It's used, usually we use it for high blood pressure, but it's give a very good effect in hemorrhoid. I would recommend.
That's good. So it's gonna help with my blood pressure too. Okay, that's great. So how it works? Like, does this gonna help me with the pain and stuff?
Yeah, actually, it works very good for the pain and for relaxing the smooth muscle around the anal open.
The fissure. Okay.
Sorry.
Around the anal fissure. Yes.
Yeah.
Okay. Is it over the counter? Can you give it to me?
No, actually,
a good solution then.
It's a prescription medication, so I would fax your doctor for asking for a prescription for that. And at the same time, we can use like a cream, lidocaine cream, one of the over-the-counter medication right now until we receive the prescription. Is it make sense?
Yes, definitely. Yes, that's gonna be a good help. So please fax my doctor. Yes.
Yeah, I'd like also to tell you to do the SIDS bath. It's like an easy bath. You will do it with a warm water. Just fill the bathtub with the warm water and sitting there for 5 minutes. And try to avoid any straining and constipation, and drink plenty of
Yeah,
water.
time is up.
Okay. Okay. Thank you so much, my dear. I will wait your prescription to be filled from the doctor, and I will definitely go with your recommendation. Thank you so much.
Thank you.
Thank you.
Sorry, I have a question.
No. Wait a second. We need goal, please. If you don't mind, can you participate with us in this situation? In this.
Okay. Okay. Yes. Okay. Would you please make bigger the prescription for the profile of the patient for me?
The prescription for the patient.
Yes, the profile, because I can't see all of them. Okay. Okay, we can start.
Okay, so give me a second, Goal, because Mohamed doesn't want to repeat this. So I'm gonna discuss this, and you can participate in the second station. I'm sorry. Okay.
Okay, sure.
She did it very well. We don't need to repeat it, actually.
Yeah. She did it very well. However, there is a disaster she didn't mention. Okay.
Sorry.
So,
Yeah, so go ahead with the assessment, Gazouly. Go ahead.
Karen, this patient is a female, right?
Yes.
It didn't ask about pregnancy and breastfeeding.
Guess what? She is pregnant. So what is the problem being a pregnant here?
She's pregnant. We couldn't. I was certain, and
Yeah, thank you so much. Okay, so you're putting her child in risk. Okay, so this lady, this is it's an ABC scheme, a scheme question. Okay, this lady is a pregnant. You have to ask. This lady is a female, so you have to ask if she is breastfeeding or a pregnant. Unluckily, she is a pregnant and she's taking irbesartan. If you ask me, I will tell you that I found out with my doctor that I am pregnant 4 days ago. Okay, first or the second or whatever trimester. So you have to tell me, okay, then irbesartan has to be stopped, and then affects your doctor to give you another medication. Whatever you said in the hemorrhoids, amazing, and 100% right. Okay, nifedipine is right. You're gonna fax your doctor, and then you said non-pharm. You just missed one question, and it put you in a second category from fully solved to marginally solved. Okay.
Yeah.
Yes.
Thank you.
No problem. Okay, so the force is. Any question, guys?
Hani's saying that.
Okay.
I don't know if you removed the point. Yeah, but he's saying that calcium channel blocker is contraindicated in pregnancy.
Yes.
No, it's not. They are not contraindicated.
Point is not contraindicated, but it can induce constipation. Okay, and that's maybe one of the main reasons. Yes, I agree with you. However, there's going to be a change in her. We cannot stop the amlodipine, but we can give Senocot, or sorry, we give Glucosamine or anything. Okay, but we're gonna change anyways the irbesartan. That's a manage. But yes, you can ask the doctor to change the CCB. I agree with you, no problem. Like, I'm fine. We're not gonna argue about this. Definitely, yes. No problem.
Okay, can we give Anasol Plus for the pain?
Give you what? Sorry.
Anasol Plus.
She already had Anasol and it didn't work. She tried so many things. I told her I tried so many things over the counter and nothing working. And because she's pregnant and she has blood pressure, so nifedipine cream is the best option. Yeah. Okay.
Okay.
No problem. Okay, Karen. So it's a very, very, very like easy question to ask, but you miss it.
Really? Yeah.
Sure. Okay. So next station.
Doctor, sorry, I have a question, please. So you said when she said is nifedipine, it's actually it's for blood pressure, but it's using for anal fissure SB said it's okay, great, it's gonna control my blood pressure. So do we have to emphasize that it's a topical one, it will not affect your blood pressure, or no need?
Yes, you can. You should actually. Yes,
Okay.
you should. It's mainly.
Okay.
It's mainly. أنت عارف أصلا how it works أساسا النيفيليبين. It's a vasodilator.
It's vasodilator. Okay.
Yes, it's gonna relax the things, and it's gonna have relief. That's it. It has nothing to do with. But when I said, oh my God, because I'm the patient, so I'm not aware. So she should be aware.
I know. I mean, I have to.
Oh my God, it's gonna help you with my blood pressure too. She said yes, it's gonna help. So I'm like, okay.
So I have to emphasize it's not gonna affecting your blood pressure, right?
No. Yeah.
Okay. Okay. Thank you.
Okay. طيب ممكن نخش. Can we move on from the first now, the fourth station? معلش محمد. Fourth station.
Yes, station number 4. Reference will be sent right away. Station 4. Here we go.
خش انت بعديها.
تخش يا عم برجلك اليمين. Who's next? Who's next يا شباب؟
يلا go on.
Yes.
Can you participate, please?
Okay, sure. I open the reference.
يلا go ahead please.
Because I prefer to print it. Okay. Okay.
Let's go. Gazouly.
We can start.
Okay, I will take care of the. خش انت يا محمد وانا I will take care of the time, please.
Okay, just a moment.
Okay.
What's your name, dear? What's your name?
Me?
Yeah.
Or Mohamed? Who wants to do the case?
Yeah. What's your name?
My name is Golrang.
Golrang. Okay.
Okay. I'm gonna start at 30 seconds and then we're gonna start.
Yeah, 30 seconds. Yeah, you have the reference. Okay.
Okay, but I can't read it well.
You have,
Okay.
you have hit the patient file.
Okay.
Okay, you can go ahead. Start.
Hello, I'm Golrang, the pharmacist on duty. How may I help you today?
Yes, dear. My name is I'm Jennifer, the healthcare I'm a nurse who's taking care of Mr. Donald Trump. He has his file here, I think. He's 84 years old and he's taken several medications with you guys. So yeah, I have a concern about his general status.
Okay, nice to meet you, Nurse Jennifer. Please have a seat. I try to do my best to help you. Yes, I see the profile of this patient, Donald Trump. They use Novorapid in insulin aspart and insulin MPH, Ramipril, and atorvastatin 40 milligram. They use all this medication as directed.
Yeah, I think, it's not a problem. The problem is that Mr. Trump is suffering more and more from like hypoglycemia. Recently, he got like 2 episodes of hypoglycemia in the last 3 months. And in fact, his wife is like, she's encountering some difficulty with glucagon injections. We heard about something, a new like glucagon nasal spray, which is called Baqsimi.
Yes.
So I wonder if I can give this medication to Mr. Trump, or should I prescribe it to him, or you can give it over the counter, and I would like to know how to use it. Okay, so it's like
Okay, sure.
been like yeah, it's getting worse recently with hypoglycemia. I don't know what the reason is.
Okay, any change in in his lifestyle that has too much hypoglycemia?
No, I don't think so. He's the same. He's
And
following
he
the
used
same.
as a directed his insulin, and he doesn't have any infection or any skipping meal, nothing.
No, I don't think so. No. Not
Okay,
to my
and
knowledge.
okay, do you know? Do you aware of his lifestyle?
His what? Excuse me?
Lifestyle, like how many caffeinated beverage that he consume, or about alcohol or smoking.
Caffeinated beverages, I think maybe one or two. Alcohol
Okay,
as well, maybe one per day or maybe one every 2 days. That's it.
and does he smoke?
No, he doesn't.
Okay, and his diet is under the dietitian or not?
It's a regular diet.
Regular diet. Okay, and does he do any exercise recently?
No, I
For
don't think
example,
so. No.
because it's too old. Okay.
No.
Okay. Yes, we have this medication. It's a Bascemi. It's a nasal spray of a single dose of glucagon, but it's only we should use it in the emergency. Okay, in the emergency condition, the patient has a hypoglycemia. We can have this medication for this patient, and but he doesn't have any adrenal gland problem or tumor in his pancreas. Nothing, not allergy to glucagon. No.
No, he doesn't.
Okay. And this medication is it's a nasal spray. It's only one dose, okay? And you should shrink the wrap, and you shouldn't open the lid. You should open the lid and remove the device from the tube, and don't test it before use because it's a single dose, okay?
Yes.
And don't press the plunger until ready to give the dose, okay?
Good.
And you should insert it to his nasal, his nose, okay? And when you push the plunger all the way, and when the green line is no longer showing, the dose is complete, okay?
Good.
And but the important thing is that we should know why the hypoglycemia repeated for him, and please tell him that wear the medic alert bracelet because of his condition, and the people who around him should know about his repeated time hypoglycemia and how to use this Bascemi. Sorry.
2 minutes left.
Yes.
Okay, Bascemi
So
medication for
it
the.
seems like it's very easy to use, right?
Yes, it's very easy, but the other people around him should know how to use it. And when he's unconscious, okay, you should use it. But the important thing is, it's after you use, you should call the 911 because it's only one dose, and maybe he needs more assessment, and we should call the 911. Okay.
Okay, no problem.
And the important things when we. Okay,
Yeah.
the important things after the glucagon, you know that it's a nausea. You should put the patient on the side to prevent the choking. Okay. And when the patient become conscious, we should give a snack, regular snack. It's important as well.
Yes. Okay. Very good.
And you can store this medication at room temperature. Okay. Do you
No
have
problem.
any other question for me?
Yes, as I told you, I don't know why he's suffering from like frequent hypoglycemia. I don't know. What do you prove? What do you think? What would be the reason for that?
Okay,
A lifestyle, a change in eating habits? I don't know.
okay, I asked you and you told me that nothing changed in his lifestyle, but he's so old. Maybe you should. Do you know that his fasting blood glucose?
His fasting, yes, it's fasting was 7.5.
7.5, and do you know about the A1C?
6.6.
6.6, and do you know the target of A1C for him?
Yes, it's like below 7.
Time is up.
Okay,
Time is
Okay.
up.
time's up. What should
So
I do?
yeah, good. Thank you so much for the participation. And actually, yes, you did very well in terms of counseling. Okay, in counseling, you did everything possible. So it's like I would give you 5 out of 5 on the counseling. But this is not everything. Okay, this is not everything. I started my case, my speech, by saying that his hypoglycemia is getting worse and worse, and we don't know what the reason. Okay, and his wife
Yes.
is like she's countering some problems with glucagon and etc. So there's something new happened here. Okay, you're asking about the eating habits. You're asking about the physical activity or alcohol or caffeinated beverages and etc. Caffeinated beverage, I assume this is like irrelevant question here.
Okay.
Has nothing to do. What if I said yes or no? What difference it would bring here? Nothing.
Yes.
Correct?
Yes.
So caffeinated beverages, nothing to do here to ask about it. But what I'm trying to say that something new happened to Mr. Trump here.
Can I?
Something in terms of his medication, and you didn't ask about that. Correct? You didn't ask if he started taking new medication, he started taking new insulin, he's recently increased his dosage, something. You didn't ask or mention anything about that. When you asked about his glycemia, his A1C and fasting, it was in the last minute of the station.
Yes, it's too late. Yes.
It's too late. Yeah,
Too
this is
late.
the first question that you have to ask. If you have a diabetic patient with hypoglycemia, you have to know to gather all the relevant information. Then you would be able to assess the situation, correct? So you have to
Yes.
gather. I told you the fasting was 7.5. Is it normal or is it like above average?
Above average because it's between 4 to 7.
Exactly. This is number one. This is the first notice here. What about the A1C? It was 6.6. Is it controlled or like it's abnormal?
Okay, but regarding his age, I want to ask that does he have any problem in moving or functional problem? Because as you know that in the
It's
diabetic
like
chapter,
assumption.
we have a,
It's an assumption from you. It's an
sorry?
assumption. It's like this is an assumption from your side.
Yes,
Okay,
no, but I
didn't.
want to ask you because I want to ask you that.
I told you, you asked me about the target, and I told you it's below 7. It's like the
Below
normal.
7. Yes.
Okay, he's not dementia. He doesn't have any dementia. He doesn't have any cognitive problem.
Okay. Yes,
Okay.
it's normal.
So here, yeah. So we have here A1C normal, fasting blood glucose abnormal. What about the postprandial one? You didn't ask. The guy's taking 2 types of insulins here, correct? He's taking the
Yes.
Rapid, correct, which is the bolus insulin, and he's taking the NPH, which is what?
It's for basal.
Exactly. So he's taking basal and he's taking bolus. And you got the information, you asked about the fasting. Fasting should be controlled by what? By what?
By NPH, by basal.
Exactly. Postprandial, if you would ask, they would have told you that it's 7. the postprandial. 7, it means it's controlled.
Yes.
So the problem here is not in the novorapid. The problem here is in pH. Okay? In pH,
Okay.
the risk of the glycemia is in pH is like far away larger than the long-acting insulins. This is number one. You would go beyond that. You would go further than that and asking about at what time of the day the patient suffers from hypoglycemia. This question is like a bonus question. If you would ask that, I would told you he's taking his injection NPH at noon, and he starts suffering from around 2 or 3 o'clock.
Oh, it's a stomachy.
Yeah, 2 or 3, 2 or 3 o'clock afternoon.
Afternoon.
First injection of the day. Yeah,
Oh,
first injection of the day at noon of the NPH, and he starts suffering from hypoglycemia about 2 or 3 hours 2 or 3 hours later. Okay, so what I'm trying to say, you have to go further, go deeper in questioning. Okay, you have to dig like in the reasons of the problem. The problem here is not the Baqsimi. It's not the way of how to counsel about Baqsimi. This is not the main problem. The main problem is the hypoglycemia. You got me? So what causes hypoglycemia here? No change in eating habit, no change in physical activity, no change in anything.
Medication.
What about the medication? Yes, exactly.
NPH, okay, we should fax to the doctor to check and inform the doctor. Yes.
Yes, and you would propose
changing the line acting, but we shouldn't do anything. Only we should recommend to the doctor. Yes. You
can, yeah. This is, you have 2 ways here to fax the treating physician. Number 2 is the nurse here is like a practitioner nurse.
Oh, practitioner nurse.
Yeah, you can ask. You can ask her if you are a practitioner or what. You have the right to prescribe. I will tell you yes, because I mentioned that in my speech that I told you, is Baqsimi over the counter or should I prescribe it?
Okay. I don't know. It's over the counter.
Yeah, you didn't notice, yeah, but it's not an over the counter medication. So
it needs prescription.
Baqsimi, yes, it needs prescription.
Yes, okay.
Okay, that's it.
Thank you.
This is the station. Okay.
Yes.
Would anyone would like to add anything? Give Lantus instead of NPH? Yes, sir. This would be a proper action. Yeah, you can give Lantus, long-acting insulin instead of the NPH. Once daily, and that's it. Any questions?
Okay, last station.
You guys, was it clear?
Yeah.
Yeah, thank you.
Okay. So let's go for station number 5.
عايزين بقى حد هاني كده.
عايزين حد هاني.
عايزين هاني كده. عايزين ميل جندر يا جماعة. في ايه؟ في ميل محتكر
مين يا شباب؟ Who's next? Who's next, guys?
في ايفون 4.
Hani did not participate, I think.
No, he did not.
iPhone 4, Jade, Noha. I think Jade is Noha. Ragda.
Sarah participated.
Yes. RS.
Abby. عمار. طيب نجيب كارين. طيب كل ما نتزنق في حد نجيب كارين.
I'm okay if no one need to, I can do it.
ربنا يكبر بفضلك يا عمار. ماشي يا سيدي، يلا بينا.
حبيبي يا دكتور، ربنا يجزيك خير.
ماشي طيب خلاص. You can start and I will Mohammed, you can start with عمار.
Me? It's you. Okay. عايزنا
ماشي
انا اروح؟
مش دي بتاعت الإله. خلاص ماشي يا عم روح.
استنى يا عم، واحدة ثانية واحدة. يلا بينا. يلا عمار let's go.
ماشي يا باشا.
Okay, you have 30 seconds عمار.
اوكي.
ماشي, go ahead.
Okay, I'm ready. Hi, my name is Amar. I'm from System Duty. How can I help you today?
Yes, hi, my name is Salma Hayek. Actually, I would like to have Plan B.
Sure, Sam, I'll help you on that. So please have a seat in our private counseling area. So you're looking for Plan B. So may I know if there is any incident habit recently?
What do you mean?
I mean, do you need a Plan B for yourself for prevent any pregnancy, right?
Yes. Is there any other indication for Plan B?
No, so that's why I'm asking you, there is any incident habit? You know, there's a Plan B, there's a time frame to use it after incident. So may I know when was the last incident? I mean, sexual intercourse, I mean.
Was yesterday.
It's today?
Yesterday.
Yesterday, okay. And I can see from profile, Salma, that you are taking Alice as a contraceptive. So do you by any chance missed any doses?
I stopped it.
You stopped it?
Yeah.
Okay. So any reason behind you are stopped it?
Yes, it gave me like a leg swelling and like some problem in my stomach.
Okay. Okay, so you are stopped it, and there is a sexual intercourse happened yesterday without any barrier or other contraceptive, right? Method.
It was unprotected.
Okay, so I can see in your profile that 3 days ago you had Alprestal, so as an emergency contraceptive too, prescribe it for you. So
yeah,
it was a unprotected intercourse too, and you got it.
Yes, it was for another intercourse since 4 days ago. And my doctor prescribed me this one 3 days ago.
Okay, I got it. So and can see you're taking escitalopram, still taking this one.
Yeah.
Okay.
On my mood. Yeah.
Okay, Salma. So okay, Salma, do you have any other medical condition I should be aware of rather than your profile?
No. That's
okay.
it.
Are you taking any non-prescription medication, any herbal, any vitamins, any over-the-counter?
No.
Okay. Do you smoke?
The smoke? No.
Yes. Okay. Okay, Salma, thank you for information. Just give me a moment to check my reference and get back to you.
Sure, go ahead.
And Salma, did you use Plan B recently in this month, in the last month?
What do you mean?
Did you use Plan B recently in the last month?
The last month? No.
Yeah. Okay. May I know your weight, Salma?
68 kilogram.
68?
Yeah.
Okay.
2 minutes left.
Okay. You said you took Ella 3 days ago, right?
What?
And you said you take Ella, you took Ella 3 days
3
ago,
days
right?
ago. Yes, exactly. Correct.
So according to my reference, Salma, you cannot use Plan B since you are got the Ella 3 days ago. You cannot use Plan B within 5 days of each other. So because they may counteract each other. So if you got the Plan B now, it will interact. It will not work. It will not get a benefit from Plan B since you are got Ella 3 days ago.
So what I have
Get
to
my
do?
point?
One of my friends told me that Ella is protective for 5 days. Correct?
Exactly. It's protected for 5 days.
But should I? So do I still have to take Plan B?
No, you cannot take Plan B. If you got Plan B, if you get Plan B now, you will not get any benefit from Plan B because the action of Plan B, it will counteract with the action with Ella that you already took.
So the
3 days
question
ago.
is, if Ella protects up to 5 days,
Time is up.
in like now 3 days only that I took it. So
Time is
I
up.
believe that I don't. So I think I don't have to take any Plan Bs, right? This correct?
Actually, I'm not sure.
You're not sure. Okay, thank you.
خلاص هاني ولا
يلا هاني يا حياني.
هاني تشجع ولا لك اخش
ايه الكيسز الصعبه دي يا باشا؟
دي سهله جدا
سهله جدا. زبده يا جدع.
Would you please answer the case?
No, we're gonna retake.
After Hani, we will answer the case. After Hani. Hani would like to participate.
Yes, please.
ده شرف كبير لينا بصراحة.
هاني انت معانا؟
Yes.
Okay, are you ready?
Can you hear me? Yeah. Can you hear me?
Yeah, we hear you very well. Okay, Gazouly, please watch.
Okay, go ahead. Go ahead.
Yo, my name is Salma Hayek. I'm looking for Plan B.
Yes, sure, Salma. I can help you with this. My name is Hani. I'm the pharmacist in charge. Please have a seat in this private counseling area, and everything we discuss will be kept confidential. As I can see from your profile, you are born on 1995, and I can see a couple of allergies, peanut and pollen. Any update on this?
Yeah, no, everything is okay.
Okay, how can I help you today?
As I mentioned, Plan B.
Oh, yeah, sure. I can help you with this. Since how many hours did this happen? Did the last
Yesterday.
intercourse happen?
Yesterday.
Okay. I can see your profile that you had Ella also looks like for the same use, like an emergency contraception since 3 days, right?
Yes, correct.
Okay. And how did it work? Like, did you tolerate it? Any side effect?
Yeah, it was fine.
Okay. I can see also that you should have been using Alice since some time, but you didn't feel it since 1.5 months.
Yeah,
Any
I
reason
stopped.
for this?
Yeah, I stopped it because of some side effects, leg swelling, stomach upset.
Did you ask your doctor for anything else as a contraception?
No. No.
Okay, any reason for that? Like, you would like to come pregnant now, or?
For pregnancy, no. I'm not planning, no.
Okay.
But I
When would you see your
don't
doctor?
want to take any pills.
Okay, so you don't want to take any pills. I can understand. And what about, is there a reason that you don't want to take any pills, like stomach thing or side effects, or?
For side effects, yes, because as I
Okay.
told you.
Okay,
Yeah.
okay. I will come to this in a second. And now I can see also that you take escitalopram for the mood thing. Is it controlled now? Like,
Yeah.
do you suffer
Yeah,
anything?
It's okay, yes, it's fine.
Awesome. Okay, before I move forward, advising you about the use of Plan B, is it okay if I ask you a few more questions?
No, thank you so much.
Okay, so what I can see from your profile that because you have received Ella since 3 days, Ella works as a protection in 5 retrospective days. This means that it has protected you already from the last instance 3 days ago, but it will not protect you for this current instance. Okay?
Okay.
If you allow me, I will have to check my reference in 1 minute and then come back to you about using Plan B after using it. Is it okay?
Okay.
Okay, Salma, thank you so much for waiting. So I figured out that you cannot use Plan B after Ella. It's not indicated because there is a high risk of side effects that's associated with using Plan B after using Ella. And what I recommend is, because Ella is not an over-the-counter medication, it's okay if you repeat using Ella, because it will protect you for this incidence and 5 days retrospective, like going back, okay? But unfortunately, I cannot dispense Ella because it's not an over-the-counter medication. I have to ask for a nurse practitioner or a family medicine doctor to have a prescription for this. Is it okay for you?
Do you have a family doctor here or practitioner? Because my doctor is not available now.
Who prescribed? I can see Dr. McKesson prescribed Ella for you.
Yeah, it's my family doctor. Yeah, but he's not here. He just traveled yesterday, I think.
Okay. Can you go into a walk-in clinic?
I don't know. You don't have one here?
I have a one here, but it's not an over-the-counter medication. It's a prescription medication.
Okay, can I take Plan B then?
I cannot dispense Plan B after Ella because you will have to wait 2 more days. And then in these 2 more days, you're not protected. Is it okay if you go into like...
I can wait 2 more days. That's a problem.
No, but you will not be protected, and Plan B will not be effective. It's most effective in the first 24 hours and least effective within 3 days. By the time that you are eligible to take Plan B, it will not be that much effective for you.
2 minutes
because
left.
I care about you, the best thing to do now is to get a new prescription of the Ella. So you can also opt into emergency if it's okay for you, just to get a prescription of Ella.
Okay, what would be the last time that I should take Ella? Or the maximum, the latest time? This is day.
Time. Okay, it's always when it comes to this kind of emergency contraceptives, the earlier the better. 120 hours after the last intercourse is the maximum window that you can take Ella within. But again, the earlier the better. So is it okay for you to go into a walk-in clinic or emergency now?
I don't know. I can try.
Right? And this is the best for you. When you come back with a prescription with Ella, I should speak to you again about like long-term contraception, because this is your second incidence, which can be like an injection or batches or anything like. It's okay for you if we speak about this later on?
Yes, okay.
Okay. Anything else I can help you with today?
No, thank you.
Okay, I will never forget to just recommend one last thing about sexually transmitted infections, because these kind of contraceptives, either the emergency or at least doesn't stop sexually transmitted diseases. So you should keep an eye on this. Okay.
Okay, no problem.
All right. Anything else I can help with today?
Thank you. Thank you.
Okay. I will wait for your prescription with Ella so we can move on. Okay.
Sure, no problem.
Okay. Thank you so much.
Okay, very good. That's very good. Okay, thank you so much. So what you did here, Hani, exactly, you referred the patient to see a doctor, right?
Mm-hmm.
Okay, it's not a bad action. It's a good one. It's a good action actually. This is a right action. Okay. What about plan B? You didn't recommend to postpone the dose for more 2 days, right?
Yes, because she received it since 3 days, so she has got like 5 days on Ella before she can start plan B, which is 2 days after the which is 3 days after the intercourse, where plan B will not be effective.
Yes, a good point as well. Very good. Okay, for me, I think everything is fine. And you recommended another way of contraception as well, correct?
Yeah, I said like you can receive, because when I investigated the reason why she's not receiving Alice, she said something related to the side effects related with oral form of contraceptive. So I recommended anything like the long-term injection or patches if she wants.
Yeah, this could be one thing. Another thing would be like the IUD. Okay,
Yes.
IUD, you would recommend that as well. She's not planning for any pregnancy very soon, and she would refer her to a hospital to like for to fix the IUD, and at the same time it will act like a like emergency contraceptive as well.
Yes.
Okay, so this would be like another option that you would recommend. But overall, yeah, I like it so much, your way of communication, your empathy, your assessment, everything was fine. For you as well, my dear, who did this station before you? Excuse me, I forgot. Ammar, yes, Ammar. Yeah, Ammar. Ammar, yes. You got a little bit entrapped in the station, Ammar. I don't know why. Okay, but it's very clear. I was trying to entrap you for the Ella. I told you that Ella is protected for 5 days. As Hani said, it's protected for 5 days retrospectively. Okay, not prospectively. So retrospectively, so it's not protective, it's not a prophylactic. Okay, it prevents any pregnancy, any risk of pregnancy for the last 5 days, not for the upcoming 5 days. You got this point? So
exactly the same as plan B. None of them protect for future incident.
No,
Only
retrospective, yes, exactly, correct.
okay, but in this condition, we should refer to walk-in clinic for another Ella, yes?
Yeah, she has still 4 days to take Ella, correct? She still has 4 days. The sexual intercourse was yesterday, So for within the upcoming 4 days, she can go to a walk-in clinic, go to the hospital, check with his doctor, whatever she want to do. She can do it in the upcoming 4 days. It's a good time. It's like a plenty of time. It's not an urgency. Okay, so yeah, referral would be a right action. If you decided to dispense as well, I can see that it's like not a bad action neither, because it's like she had a new prescription, she had a recent prescription, and the medication was like very tolerated and it was good. So some of you would recommend dispensing Ella one more time. So like for emergency situation, this for me, I believe this would be not a bad action neither. But it's like Ella, so Ella is like a prescription medication, it needs prescription. It would be better to refer to get a prescription.
No refills on the prescription. No refills on the prescription.
Yeah, no refills. No refills, but yeah, يعني بقى ممكن ناس تاخد القرار تقول لك يعني I have my reason, I can justify it. Justify the medication was taken.
ماشي، بس لو هتعمل extension أو interim supply الدكتور مش موجود عشان يرد على الفاكس.
No, you have to notify him. When you do extension, you just notify. You don't need any permission. You got it? You notify him. He's taken, the medication was taken before, and medication was tolerated, no side effect, and it's the right medication. You have only 2 options here. Plan B is not recommended as per your reference. The other option is Ella, and this is the right action. Okay, so this would be justified. You can justify it. Okay.
لا.
But anyhow.
انت عايز تعمل ريفيل على دواء اتاخد مره واحده بس، دواء مش كرونيك اصلا، دواء emergency contraceptive، هتعمل عليه ريفيل ازاي؟
So because this is, as you said, it's emergency contraceptive. It's not chronic.
Okay, I agree, but this medication has been filled by the patient only once. I'm not sure if we are able to make a refill without.
Okay, guys, do not forget.
Point. Sorry, Mohammed. This point, there is a discrepancy between provinces. Mohammed can do it as he practiced in Quebec. We cannot do it in Ontario. I agree with you, Henny, but from Mohammed practice point of view,
It's not like that. No. I'm talking here federal. Okay. But what you can do here, okay, what you can do here, this is like a judgmental situation. Okay, you have your own. There is one of, as I said, referral is a good scenario. Some of you may recommend to give Ella as well, like being the doctor is not here, doctor is traveling, is not here, and this is emergency situation. If you would, this is my judgment, if you would give Ella one more time and justify it and make the documentation, this is not a bad action. Okay, it's correct. Why it's correct? Because in this situation, you have only 2 options. Number 1, Plan B, it's not recommended here. The other option would be what? Would be Ella. Okay, you don't have a third option. This is in terms of medication. So as long as you can justify, as long as you can document, no problem with that. Far away from what province you are practicing or something. Okay, the other option, if you, as I said, if you are not at ease with that, if you feel not uncomfortable with that, so don't do it. Refer the patient, and that's it. Okay, so here it's a professional judgment. You can do it, you cannot do it, but I can do it. I have my own reason. You don't want to take any risk, that's it. At the same pharmacy, by the way, if when you get your license and work at the pharmacy and you work with another pharmacist at the same, you may do something the other pharmacist wouldn't do, and vice versa. You got me? Okay. So
yes.
like,
but I have a question. It's not an emergency. The patient has a 4 days.
Exactly. It's not emergency. 4 days, you can go to the emergency room.
They can go easily and take
Yeah, that's it. That's it.
Description. Okay.
It's not, as we said, it's like she's fine for 4 days. She still can take Ella for the upcoming 4 days. No rush here. Better to go to see a physician. That's it. Okay.
Okay, thank you.
Okay, so very good. Thank you so much, Hani and Ammar. Any questions, guys?
No, thank you so much.
Thank you so much. Okay, so what we meant to say, sorry, Hani, sorry for interruption. I will let you speak. But what we meant to say about the patient care is you have to look at the four corners of the patient condition. Okay, as we said in the first scenario, the patient is taking, she's 36 years old, she's smoker, and she's taking combined contraceptive. Okay, you can intervene here. You can make your intervention in this as subject. Okay, this is number one. At this situation as well, you explained everything thoroughly to the patient. Hani, you explained everything in a very good manner. Okay, why you cannot take plan B? Because it may interact and etc. Okay, what about your contraception? Are you planning for any pregnancies? You said no, so why you're not? You can take any other options like the injection, 3 months injection, or you can take the device, intrauterine device. Okay, so this is what we are trying to say. When you get assessed for patient care, you get assessed for all aspects of the patient care. Okay, what is the problem? What is the problem? Like the situation of hypoglycemia. The problem is not how to use the Baqsimi. The problem was the hypoglycemia.
Yes.
Okay.
In this case, should we ask, are you sexually are you multi-partner or not?
Sorry, I didn't get you.
No, I should. In the case of Plan B, should we ask that? Are you multi-partner?
Yeah, no problem. You can ask. Yeah, you have the right to ask.
Multi-partner, we should refer to the doctor for more assessment as well, because this medication is not preventing from sexual transmitted infection.
Yes, but you're not gonna refer her because she's multi-partner. She has multi-partner.
Okay, but
you're gonna refer her for assessment. Yeah, you can.
Yes, for assessment. Yes, in the future should be assessed.
You can advise if she got any signs of like infection, any discharge, any something looks abnormal to her daily hygiene or something. She can go to see a doctor. We do recommend to see a doctor.
Okay, thank you.
No problem.
So my question, Mohammed, if you please. Now we need your help with the non-interactive.
Yeah. We can do next session non-interactive. No problem.
Like even like I don't know if you'll accept this recommendation. Like it's all up to you guys. But if there is anything like a Word file or a PDF that like you can leave it on the group, and then each and everyone who is going to contribute to the next session will solve it by his own. You know what I mean? And then we can compare the answers best as what you will give. And then you can explain like how did we think about it and what's right. You know what I mean?
Yes, definitely. It's a good idea actually. So we can we're gonna show you guys the stations, let everybody solve it, and then after 7 minutes we can come back and discuss everything. No problem.
Makes sense. Yeah.
Yeah.
I'm not implying something to you guys. Sorry.
No. Why you are being so polite, Hani? It's okay. It's a good idea actually, and I hope everybody participate. Seriously, yes, that will be the best option. It's a good idea, and we will do it 100%. Thank you for interviewing. No problem, Rish. هنينا لك مسيو هاني. ورمضان كريم يا ريس. Hani, do you practice in Canada or no?
Yeah, I practice. Yeah, I practice in India.
Are you in Shoppers?
Yeah.
In Ontario?
Yeah. Why did you think about this? Like, how did you reach this conclusion?
No,